More than 36,000 Te Whatu Ora health workers are downing tools today and taking strike action over what they say are poor staffing levels that leave patients in danger. The Health Minister has slammed the strikes, saying they put politics before patients. Nathan Clark is a Hutt Valley nurse and a New Zealand Nurses Organisation delegate, and he joins us now from Wellington. Good morning, Nathan.
Good morning.
So tell me, why today? Why today for this strike?
Oh, look, it's been building and building and building. We've raised the issues of unsafe staffing levels for a number of years now, and it's only just come out yesterday from the Ombudsman's actually criticised Health NZ for not releasing the information that says, between 2022 and 2024, anywhere between 30 and nearly 40% of our shifts had some form level of understaffing. And that's a real crisis for us, and that's a real concern for our patients.
Does that matches how you experience life on the wards? Is it that you're at that level where you're 30 to 40% down?
It barely a day goes by where there aren't areas that are understaffed. And to me, that's a real concern for our patients. We're doing this for our patients. We're raising this concern for our patients because ultimately that's what we go into health for, is to look after people, to care for people. And across the spectrum of healthcare, it's when we're seeing shortages, and it's not to just see the numbers and see the statistics, that it actually puts it into a cold, hard reality of what we're facing every day.
Yeah, I guess it's it's a little bit like medicine sometimes. You've got to sort of be harsh to get the cure. But does it feel like this is falling unfairly on some of the patients, maybe the 13,000 that the Health Minister tells us will have operations or appointments disrupted today?
It is very tough for those patients, and we very much empathise for those patients. But we've got to look at how many patient appointments or procedures actually get cancelled because there aren't enough staff there. No one's actually been able to produce those level of figures. So for the unfortunate, and we do empathise with the patients, we really do, but we've got to get these safety and staffing numbers up. We really need to have this full commitment to CCDM, and it's something that we've been fighting for years, to have CCDM rolled out right across the country to get these numbers so we've actually got staff able to care and provide the care that patients deserve. And this is what it's about.
CCDM's a bit of a jargon there. Do you want to unpack that one for us, Nathan?
So this is the CCDM. That's the Care Capacity Demand Model that was agreed upon between the former DHBs and the New Zealand Nurses Organisation as a key indicator for staffing to meet the demands and the care capacity demands that patients require. So if you're working on a surgical ward and you've got a very high complex post-operative patient that requires a lot of care, they're going to take more care and hours to provide the care that patient needs and deserves. So if you've got one nurse and they've been allocated 4 patients, which would be an ideal nurse to patient ratio, but if you've got one of those patients and your 8-hour shift, they take 4 hours of your clinical time, and you've got allotted another 2 hours clinical time for each patient looking at the care that they need, you very quickly do the maths and suddenly go 4 hours for one patient, 2 hours for the other 3 patients. I've got 10 hours of clinical care that needs to be provided in my 8-hour shifts. Now we do the maths, 10 into 8 doesn't go. I'm already 2 hours nursing hours deficit. Now, if you roll that across a 30-bedded surgical ward, it doesn't take too long before you suddenly start seeing where those care deficits are. And nobody wants to go into hospital and come out harmed. Nurses don't want that. Health professionals don't want that. Even Te Whatu Ora Health NZ does not want harm to come to our patients. But when we're running, 30 to 40% deficit on some shifts, that's a real danger to our patients. And it's a danger to our staff as well. They become fatigued. They start suffering from moral injury because they know that they can't provide the care that patients deserve. And ultimately, they leave. And we don't want that. We want to train our own nurses, grow our own nurses, and employ our own nurses, which just isn't happening.